Hi everyone, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about hiring for FQHC practices. You might not be familiar what an FQHC practice is, but it's a federally qualified healthcare system that's focused around primary care and coordinating of care for patients in underserved areas. It's funded by the government in a lot of ways, and in order to qualify to be an FQHC or a rural health clinic, which is an RHC, which is very similar, you have to qualify, you have to fulfill a lot of requirements. Fulfill is a good word. I want to say jump through hoops, but that's not very fair. It's very stringent, very strict guidelines on qualifying for being recognized as a federally qualified health center. And you want to make sure that when you're hiring people for this, that they are qualified and understand the requirements of working in an FQHC. Now, when you're hiring for any position for FQHC or an RHC, there's no like specific criteria different than hiring for any other practice, honestly. I mean, they need to make sure they're not on the exclusion list with the OIG, which you should be doing for all staff anyway. They have to make sure they're in good standing with other commercial payers. Their licensure is clean. I mean, all the things that are an ideal candidate, right? Because you have the federal eyes looking on you. So you want to make sure somebody has a very clean record. They understand that they're going to be held accountable, probably stricter than other areas. So as long as they check out and background check the OIG stuff, their licensures, their schooling that they say they went through, as long as you do your due diligence that you should be doing, whether it's an FQHC, RHC, or any other medical practice, you should be fine. The biggest thing with the FQHC, like I said, is that it's under very strict guidelines. It is very hard to qualify. I mean, there's a lot of things that have to be in place and continuing to go in order to qualify. And you do serve, working in an FQHC or RHC, very underserved populations, a lot of Medicaid, a lot of people who might not have health insurance, people who don't do regular checkups. And the purpose of the FQHC is to promote people taking better care of themselves, even if they are underserved or impoverished. And so you do deal with a more difficult population in a lot of ways. But the FQHC is very beautiful in the fact that it has all the resources in one place. So it has the primary care, it has imaging, it has labs, it has mental health services. It has a variety of health services for these people, and it's all co-coordinated together. And that's what's really beautiful about it. And it's definitely a high demand in certain areas. They're always looking for providers because the burnout, I think, is very high given the population, given how busy it is, just turning out patients because so many people want to be seen. And a lot of people being hired to work in those locations don't realize it going in. A lot of people have good intentions of wanting to work in an FQHC or an RHC because they're doing something good for the community, for humanity. But at the same time, it definitely takes a certain mindset. It takes a certain personality to be able to handle the day-to-day stresses that go along with it. And I'm not trying to sound negative about it or stereotype anything. It's just kind of the way it is. And there's nothing negative about it. It's just the realism behind it and making sure that when you're screening your candidates for whatever position it is, whether it's a provider, a therapist, a lab tech, a front desk person, registration, medical assistant, nurse, that they're aware of exactly what goes into working in one of those places. And maybe even doing some kind of shadowing before you offer the position or a pre-term condition for hiring people of having them come in and shadow for a day, half a day, to see specifically what they would be doing and how they would be doing it, what kind of population they'd be dealing with, because not everybody's cut out to work with all populations, right? Like I know people who love working with babies and little kids, and then I know other people who can't do kids and babies, but they love the older adults. I personally don't have a preference. I can work with everybody. I really enjoy patient care in general. There are some that are more challenging to me than others, but I've never disliked a certain population, but that's not very common in healthcare. Usually people gravitate towards one type of population or another, just because that's where their heart is, that's where they feel they're needed, that's where their gifts are. And although I can work with all populations, my passion is working with the older generations. I love working with Medicare aged people, and I love hospice care. Like that would be my go-to. If I was a nurse or a provider, I'd probably focus on gerontology. When I was younger, I always wanted to do emergency medicine because I love that trauma like level adrenaline and thinking fast on your feet. But as I've gotten older and I've worked more in healthcare, I just really love the older population. So that being said, maybe people can work in an FQHC, but maybe they just get burnt out faster, or it's not something that they end up enjoying long term, and then they leave. So I think that there's a lot of factors that play into hiring staff for FQHCs and RHCs. And I got asked by a viewer to talk about the criteria that's required for hiring for these specific types of situations. And I wasn't aware that there were any specific requirements different than anything else. And based off my research, because I just wanted to make sure that was confirmed, but it was brought up a lot about how turnover is high because people get burnt out. They don't understand what they're going to be working with or how they're going to be working. And that's what's causing some of the troubles. And I don't know the history behind the question of the viewer asking me to do that. So I don't know if it's because they're starting an FQHC and just want to know if there's any specific requirements, or if they're experiencing a lot of turnover and maybe trying to find ways to avoid that in the future. But nonetheless, I think the big takeaway from this is making sure that people understand what kind of population they're working with, the hours, the on the feet all the time, the high volume of patients, and just the extra eyes on everybody, because it is a federally funded healthcare system or subsystem, I guess you can say, that there is a lot of very strict, I think it's more strict because you have people checking in on you and you have to hit certain quotas and you have to have certain entities come out and make sure that you're staying qualified in all the areas. It's just a little bit more stressful overall in general than just working in like a private practice. So I would just make sure that you're very transparent with candidates when you're hiring. Again, making sure you're doing all your own due diligence to make sure their background checks out, the OIG exclusion checks out, their licensure is good, their education is what they say it is, their work history is what it says it is, which you should be doing no matter if you're a manager or administrator or provider hiring. In any situation, you should be doing that. So anyway, I hope this helps everybody who has questions. I hope if you are unfamiliar with FQHCs and RHCs that you learned something new today. And if you have any questions or comments, again, please leave that in the comments below. I try to answer them quickly for you. I love the interaction, so I encourage it. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this video with your colleagues. Thank you so much. I hope you guys are well. We'll see you next time. Bye-bye.